If you're having problems getting one of your back pain patient cases better, you might consider a few other structures. It's very common, for example, for chiropractors, for us as chiropractors, to focus on the joints, like the SI joints, the facet joints, and the discs. But there's a lot of other structures in there that can be the source of low back pain. And I want to take a look at those with you today, because these are the things that we're going to teach you to treat in our spine level 1 and spine level 2 courses. So if we first look at the back here, and I'm using the Visible Body anatomy software, which is a great way to explore the anatomy. The first structure, superficial, after we've removed the skin, of course, is this stuff here. That's the thoracolumbar fascia, which is a sheet, an aponeurotic-like sheet that almost acts like a tendon, and it attaches into the glutes over here, and it attaches down into the dorsal sacral ligaments and over the top of the on the spinous processes and over the top of the erector spinae. So let's take it off here for a second. We'll hide that. And then underneath it, of course, we all know about the erector spinae, and we think about those all the time as practitioners. So let's take those off, because wait, there's more, right? So here goes the erector spinae. And now we've got, these are often overlooked, the multifidus and the rotatories that are down here. And these are segmental. They go from the transverse processes to the spinous processes, and they help in stabilizing segmentally the spine. But they're often overlooked. They're deep, but we'll teach you how to treat those throughout the spine. And then we're going to zoom in. Let's see if we can get a better look here. There we go. There we go. Okay. And right up here, of course, our good friend, the quadratus lumborum, and this is an important structure as well. So what I'm going to do is I'm going to take the obliques off, and yes, the obliques can also be issues in low back pain when they affect how the spine rotates, but in the context of this video, we're probably not going to have enough time to go over all that. So I'm going to hit the main key players. So that looks like a small, inconsequential player, the quadratus lumborum, going from the iliac crest up to the lower ribs and probably tying into the intercostals and into the iliocostalis muscles. But it's a trilamina muscle, meaning it's got 3 layers to it. And sometimes we're going to have to go around here and treat it from the front, where it's in contact here with the psoas, right? And psoas is another big player in back pain. So we're going to take the erectors off here. Okay. What else can be a source of back pain? So there we go. The posterior and anterior intertransversarii, the long dorsal sacral ligaments, the supraspinous ligament. I'd have to take this off for us to see that. Supraspinous ligament is that little thing right there. Important player. And then a big one. And let's see, we're going to take this psoas minor, psoas major off. And then we're going to look down here at the iliolumbar ligament. So all of these are structures that can be limiting your low back patient. So if you're not getting what the corrective exercises, you're not getting it with manipulative therapy, or you're not getting it with generalized soft tissue work, sometimes you need to be really specific, and you need to get your hands right on those specific structures. And those are a few of the structures that we'll be working with you on in our classes at Active Release Techniques Europe. I hope that's helpful. Take care. Bye-bye.